right. Well, hello and welcome. We're so glad you've joined us today for our webinar on the intersection of mental health and psychedelics. My name is Allison Neiman, and I am the CEO of Mindful Philanthropy. Mindful Philanthropy was launched in 2020 with the mission of catalyzing impactful funding to mental health, addiction, and well-being. And so we have three pillars to our work. We connect and we convene funders through our gatherings and events. We guide funders through our strategic guidance and other solutions, and we uplift impactful opportunities for impact. And so today we're here to explore actually a question that we get often from funders is, what does psychedelics have to do with mental health? And what is the current landscape of psychedelics? So we know the first wave of promising research into the use of psychedelic medicines was supported critically by philanthropy in the early, but was cut short in the 1970s by legal and policy shifts in the US and abroad. And now we're seeing a resurgence of both interest, research, and philanthropic support in the psychedelic field. And it's opening new pathways for healing with some of the most challenging mental health conditions, such as PTSD, substance use disorders, depression, eating disorders, and more. And so today we're grateful for the Psychedelic Science Funders Collaborative for partnering with us on this event to discuss the latest developments in the field and how these can integrate with the broader mental health ecosystem, and where philanthropy in particular can have the greatest impact. So before we jump into our topic, I'd like to go over a few housekeeping items today so you know how to participate in our event. At any time during the webinar, you'll have the opportunity to submit questions for the panelists. You just type them in the Q&A box at the bottom of the control panel. And as time allows, the presenters will see those and incorporate them into their answers. They'll try to get through as many questions as they can. And we are recording this webinar, and we'll be sharing the link after the event. Additionally, we'd like to include that subtitles are available for today's discussion, and you can turn them on by clicking the closed caption button below. But please do bear in mind that they're generated automatically in real time, so we apologize for any inaccuracies they might have. So as we dive into our discussion today, I'm thrilled to welcome Graham Boyd, who is the co-founder and executive director of the Psychedelic Science Funders Collaborative. So Graham, so glad to have you joining us today. And I'm particularly thrilled with our partnership. This has been a long time coming, as we share a Tyler Norris, who has been a founding board member for Mindful Philanthropy and really active in your work. But also we sat at dinner one night and kind of dreamed about what it could look like to partner together and to think about doing an event. So thank you for joining us. And I want to start just with, just give us a little bit of an overview of the mission of the Psychedelic Science Funders Collaborative and of your work more broadly.
Sure, and it's just such a pleasure to be here. I just clicked on the list of participants and see some old friends who are among the audience. So hello to you and many new people who I haven't met before. And it's just such a pleasure to be here. The mission of PSFC, Psychedelic Science Funders Collaborative, is to create access to psychedelic healing for all who can benefit. And so some of my colleagues are going to speak afterwards and kind of break apart what all that means in terms of access. But we've been around for a mere 7 or 8 years, and so much has happened in the meantime. I think the publication of Michael Pollan's book, How to Change Your Mind, really raised awareness of the potential of psychedelics, or in some cases reminded people of that. It was, I think, something that was talked about a generation ago. And now it's everywhere. And so I have no doubt that psychedelics are going to be an important part of mental health care more broadly. That is in our future. And I think our job here at PSFC and the philanthropists, the 170 philanthropists who are members of this, is to really try to shape that in a way that does the most good and also prevents harm as much as possible. And so we're really attuned to all of that, trying to build science, collect data, fund the best projects, and really create as much healing as possible. We are a funder collaborative, and I really admire the work that this collaborative has done, and that Tyler is a founder, and Allison, you as the ED. You are tremendously successful at what you've done, and I'm eagerly looking for lessons and ways to collaborate. So thanks for having us here, and look forward to hearing the rest of the presentations.
Well, thanks, Graham, and thank you for your kind words. I think that there's so much work that we can do together and collectively, and we are always looking for great partners where we can elevate one another's mission and really go after the work collaboratively. So thank you for being here. And I want to invite someone who has been a part of the Mindful Philanthropy Network. In our network, we work with over 850 unique funders that are all over the US and the globe. And one of the funders we have joining us today has been involved with Mindful Philanthropy really since almost the beginning. And we have worked with her on thinking about her strategy, helping her to learn as she's been on a significant learning journey that included novel therapies and innovative approaches, which led her on her journey to discovering the work of Psychedelic Science Funders Collaborative. After Laura joins us, we're going to immediately turn it over to Tyler Norris, who's on the board of Mindful Philanthropy, who's going to continue to host our conversation. So Laura, I'm really excited that you're here today to share a little bit more about your story in mental health more broadly, and then the role that psychedelics has played in your learning journey. So could you share with us a little bit more about that today?
Thanks, Allison. Yeah, well, as a member of both the Mindful Philanthropy community and the PSFC, I'm really happy to see these two communities coming together. I think we all share a common vision, which is a world where all people have equitable access to the tools and resources they need to be well. So I'm really happy to be here. As a newer funder to the space, as Allison mentioned, the Mindful Philanthropy team has been very just instrumental in helping me develop my own personal philanthropic strategy for mental health and identifying areas that are not only high impact, but also deeply meaningful to me. And psychedelics is one of those areas. And a couple years ago, I was fortunate enough to attend a Mindful Philanthropy gathering where I met Tyler Norris, who you'll hear from in a little bit, who's an early board member at Mindful Philanthropy, and he introduced me to the team at PSFC, and I've been an active member ever since. So I wanted to just, share for a couple minutes why I think psychedelics matter for mental health, and why philanthropy is needed. But first, I thought I'd sort of share a more personal story on how I came into this space. So I come from a family with a history of treatment-resistant depression and bipolar, grandparents on both sides who tried every treatment available to them but never found anything that worked. I've personally also struggled with depression and anxiety off and on ever since I was a teenager. And although I've been fortunate enough through therapy to learn tools and skills to manage the symptoms of my depression, using these tools has always required a lot of hard work and energy. And I've never really felt like it was addressing the root causes of my depression. And while SSRIs have been recommended by numerous providers, I've always been resistant to taking them because I worry about the side effects, worry about the trial and error process of finding the right one or the right combination, the right dosage, worry about lifelong dependency, and worry that my grandparents and as many as 1/3 to 2/3 of people with depression, they might not work at all. So we really need new tools in this space. There hasn't been a lot of innovation in mental health treatment since the development of Prozac in the 90s. And so sort of been sort of novel therapies has been an interest area of mine for a while. About 4 years ago, I read Michael Pollan's book that Graham mentioned, How to Change Your Mind on the History of Psychedelics and the latest research into their therapeutic potential, and just found it incredibly compelling. The stories of healing, the scientific evidence showing that psychedelics can rewire the brain for people with depression, often leading to remission. And I became curious and wondered if a psychedelic experience could kind of help me rewire my brain and break out of the constant ruminations and negative thought patterns that dominated the way that I saw the world. But I didn't know how I was going to find safe and legal access to psychedelic therapy. Like had never done psychedelics before, never been to Burning Man, don't have friends in those circles really. But 6 months later, I attended my kids' elementary school fundraiser. And believe it or not, one of the items being auctioned was a package of 4 ketamine sessions with psychedelic coaching. And yes, this was a public elementary school fundraiser in the Bay Area. And so that's how I actually ended up trying ketamine-assisted psychotherapy for the first time. And it was for the kids. It was a complete game changer for me. It was the first time I had felt joy in nearly a decade. The ruminations were just completely gone, and I was able to release resentments and forgive important people in my life who had hurt me. I was able to see things with a new perspective, and those changes were lasting. So I felt really lucky I could afford and access safe psychedelic healing, but I know that many cannot. Would love to see a world where safe and affordable, legal, accessible psychedelic therapy is just another legitimate tool in the mental health toolbox, where a patient can, comfortably talk to their doctor or therapist about it without judgment, be referred to a skilled practitioner, have it covered by insurance. And I'm hopeful that we'll get there, but it's going to take time and take resources. Um, we need, more scientific research to understand how psychedelics can be most effective. We need a trained workforce to safely and effectively administer these drugs. We need public education to combat the misconceptions that are out there about psychedelics. And we need progressive policies to provide broader access. And philanthropy is going to continue to be critical in this movement. Government funding remains just a small sliver of the total need, and the private sector hasn't really figured out a way yet to make money off of a pill that you could just take once, although they're trying. The PSFC has been an incredible asset in my learning journey around psychedelics. I've had the opportunity to connect with and learn from many of the greatest thought leaders in the psychedelic field. I've been able to partner with like-minded colleagues and support organizations doing some of the most important work in the field. And I've been able to gain sort of balanced perspectives, I think, on sort of the promise and the pitfalls of these medicines. It's kind of still the Wild West out there. So having a trusted partner to help navigate some of the noise has just been really valuable. So I invite anyone who's interested in learning more about the PSFC after today's session to please reach out. We'd love to have more of this group's thought leadership incorporated into our work. And so now I'm going to hand it off to Tyler Norris, who's actually a personal hero of mine. I first came to admire his work nearly a decade ago when he was VP of Total Health at Kaiser Permanente, and then again as CEO of Wellbeing Trust, and now he's serving in a leadership capacity at Mindful Philanthropy and the PSFC, and he wears many other hats as well. So I will let you take it from here, Tyler.
Laura, thank you. What a beautiful personal testament and a reminder of the powerful transformative quality, not only for ourselves, but for our families of these medicines. It's a delight to be able to be invited to moderate this conversation with so many friends and colleagues here. Been on the Mindful board since the start. My primary work is with the CEO Alliance for Mental Health, helping mobilize the field around ensuring equitable access to mental health care in the country. But my family, too, has benefited significantly from psychedelic therapy. And for that reason, I've been very involved with a number of organizations, including Naropa University, helping build the psychedelic therapists of the future through its Center for Psychedelic Studies. And I know Chuck Leaf is on this call. To help lay a groundwork for today, my good friend Dan Grossman is here. He's the head of field building for the Psychedelic Science Funders Collaborative. He comes to PSFC as the former managing director and senior partner at Boston Consulting Group. And Dan, you've brought your formidable skills to helping build out a strategic roadmap for the field. And maybe you could share a little bit about PSFC and some of the fundamentals that will lay a groundwork for this dialogue. Dan?
Sure, I'd love to. Thank you, Tyler. Thanks for the kind words. And I'll echo Lauren saying you are also a personal hero of mine, but I won't spell out the history of how that came to be. I wanted to say a few words that'll help to bridge between what you heard from Graham and Laura about what PSFC is all about to the relevance of the work that you're going to hear about from our panelists in a couple of minutes. And I promise it won't be a lot of slides, but I would start just by noting the really incredibly rapid increase in interest across our culture in psychedelics and in psychedelic assisted care. You've heard several references to Michael Pollan's 2018 book, which actually followed a very influential long form article that he'd published a year or two before that. But there's much more that's been going on. Last year in 2023, we had the largest ever conference on the science of psychedelics took place in Denver, sponsored by MAPS. 12,000 people attended. It's a pretty big conference. It is a biennial event, so it'll be coming back next year. I believe registration's just opened. Maybe I'll tell you more about that at the right time. But you also see other things much more in the technical side. So in the mainstream mental health system, we actually now have reimbursement codes for psychedelic assisted therapy that therapy providers and insurance companies can use to bill and to reimburse for psychedelic assisted care. We also have attention from, and you see the item on the far right of the slide is refers to a report by RAND, the very, very well-respected nonpartisan policy analysis institute, looking at the state of state policy around psychedelics and looking at the different alternatives and what kinds of policies might work, might work better or worse for public health under different circumstances. And then, of course, at the bottom, I've included a snippet of the increasing attention in the bioethics community around psychedelics. And that one's going to be particularly important for reasons that I'll say a word or two about. And this is a small sample of everything that has happened. These are some of the best informed examples, but there's a tremendous amount of discussion of psychedelics and their potential across all aspects of the culture. But this is both, propelling and being propelled by progress toward legal access. All the discussion in the culture it's interesting, but in the absence of legal access, the impact is, there's not going to be much to speak of. But we have two different major paths, really highways toward legal access that are emerging, that again are fueling and being fueled by the cultural discussion. The one on the left refers to, FDA approvals of psychopharmacologic agents. In some sense, like any others, of course, there are differences in the way they are used, but the regulatory rails that we have for bringing forward a new drug, what would be bringing forward a new SSRI or SNRI hybrid, can also be used to bring, can be used to bring forward a psychedelic drug. And some of the upcoming examples you see from, Compass Therapeutics. You have a candidate probably coming late 2026 of psilocybin for treatment-resistant depression, one of the toughest areas of medicine. This is people with depression who not only are not adequately served by SSRIs or other agents, but don't actually respond to them at all, which there are too many people. Behind them, you have a company called MindMed, a very credible company with veterans from the pharmaceutical industry testing LSD for generalized anxiety disorder, which, if it is much more, it's a much more impairing and significant mental health disorder than too many people realize. So hopefully those in this call are more knowledgeable about it. And then we have a nonprofit, the Usona Institute, also seeking to bring psilocybin forward for major depressive disorder. Not the same as treatment-resistant depression, but intersecting it, but a massive population suffering from major depressive disorder and not adequately served by today's therapies. So as the FDA considers each of these applications, it's extremely likely that we're going to see some come through this channel. I will also acknowledge, of course, many of you would have seen the news of Lykos Therapeutics' efforts to get approval for a psychedelic drug for post-traumatic stress disorder, an area of tremendous unmet need in many high-profile populations. That was not met with success the first time, but we're optimistic and have expectations that they will be taking a second run at it in the coming years. So that's one channel. The other legal channel toward access to psychedelics is in state policy. The particular note, two states, the ones highlighted in red here, really, one state has implemented and the other has passed, the legislation and is on the verge of implementing state-regulated supervised use programs of a traditional classic psychedelic substance, that being psilocybin, not limited to specifically medical settings, but potentially very useful in community where so much mental health care actually happens beyond the walls of hospitals or classic physician offices. But beyond those two, many other states have considered or are considering a variety of bills that encourage research, that reduce penalties on the use of psychedelics, that grow access in medical settings, and that grow access beyond medical settings. I say 20 plus here, but in reality at this point, it's closer to 30 that have considered or are considering such bills. Now, before I flip the slide, this progress, what we're extremely mindful of is that this requires really careful consideration. Psychedelic medicines are extremely potent. There's abundant evidence that they can alleviate severe mental health conditions. There is also abundant evidence of the potential for harm, that they can be used for harm or that they can inadvertently cause harm. That requires that anyone involved in the psychedelic ecosystem needs to tread carefully to make sure that as we play our part to introduce psychedelics into the mental health system or mental health systems, we do so in a way that's genuinely healthful and really delivers on the full potential that psychedelic care offers. Now, if we flip ahead, that brings us back to the role of PSFC, where we feel like philanthropists in the field, and philanthropists are still fueling much of the work in the field. They need to both be aware of and support efforts across many domains, and those domains are shown here around that circle. I don't think I should take the time to go through them all, but you're going to hear some in-depth thinking about several of them from our panelists in a moment around policy and advocacy, around Indigenous conservation and learning, and around health equity. But there's work being done, fantastic work being done across all of these, but still with a long way to go. And I use that to cast another light on what Graham shared about PSFC's mission, which, I sort of fundamentally see PSFC as helping philanthropists to support the responsible integration of psychedelics into our mental health care systems, both the sort of the pure FDA one and those that take place more in community. And when I say PSFC helps, there's PSFC staff like myself who try to help with our sort of roadmap for collective philanthropy to advance psychedelics, so staff like me helping. But also, it's a big characteristic of PSFC, and one that Laura would have experienced. It's philanthropists helping each other to learn and find the most impactful opportunities. So I will probably leave it there, and I'll give it back to Tyler to introduce our panelists, and I hope that will lay useful groundwork to contextualize what each of them will share with you.
Very useful groundwork. And with that, I think we'll tip to the state pathways by introducing Taylor West, who's the Executive Director of the Healing Advocacy Fund. And Taylor and her team are working towards safe legal access for all, with a focus on implementing regulated programs, not only in Oregon and Colorado, but to support the success of state integrated therapy programs as they roll out across the United States, hopefully with Massachusetts coming online and others. Taylor, you've been in the field a long time, although relatively new in this particular role. Could you give us a bit of a context for Healing Advocacy Fund's work? What are these regulated programs? How do they work on the ground? And kind of what is your team trying to do to bring quality to these state programs? Taylor?
Thank you, Tyler. And I'd like to point out that a long time means something like 4 years, which is a fantastically long time in the psychedelic policy world. The idea behind the state psychedelic therapy programs and the Healing Advocacy Fund's commitment to supporting them is the belief that what we know about psychedelics and mental health mirrors what we know about broader mental health care, that there's no such thing as a miracle drug, but that there are treatments that can safely provide significant benefits when delivered in an integrated therapeutic context. We also know that our federal healthcare bureaucracy doesn't always lend itself to these integrated approaches, and I think we especially see that when it comes to mental health. So the state programs offer an opportunity for us to build integrated approaches to psychedelic care into the policy itself. And these are policies that are built to center safety and to center facilitated therapeutic work. The other great thing about state programs is that they offer a flexibility that we don't see at the federal level to respond in a more nimble way when we learn new things about what's working and what's not, when we learn things that we need to adjust around particular communities, or when we have findings about safety or efficacy that we can then incorporate into the program. HAF's work is not about just throwing open the doors to access to psychedelics. Our goal is to build programs that give people safely designed, accountably facilitated care, whether they have a specific condition, like we talked about with some of the FDA path, or if they have the desire to build mental wellness and resilience before they have a specific diagnosis or a critical issue. And this is an important difference from the strictly diagnosis-based, strictly medical program, that this can be used in a preventive way as well. We know this is still a new idea to a lot of people, and one that people want to be cautious about entering into. But we believe that investing in these carefully designed programs that work in tandem with established mental health and addiction services is the best opportunity to scale the significant potential that we see from psychedelic therapy. And part of our work at Healing Advocacy Fund is really to serve as a bridge between the world of psychedelic research and psychedelic advocacy and more mainstream institutions like legislatures, regulatory agencies, health and behavioral health care providers. And I'll give 2 examples of that and then hand it back to you, Tyler. I think one great example of this is an ongoing collaboration that we've built with Mental Health Colorado, which is part of the Mental Health America Network, We've done a series of very well attended webinars with them in which we're offering education geared toward clinicians in Colorado who are either interested in providing psilocybin therapy themselves or just want to know more for when their patients or their clients ask questions. Another is intensive work that we've done in both states to build dual licensure into the state programs. And that means that clinicians who are licensed in one area of health or mental health care, therapists, psychologists, addiction counselors, that they can become licensed psilocybin facilitators or just talk to their clients about psilocybin therapy without having to worry about putting their clinical license at risk. And in Colorado, we actually managed to get that baked into the original rules for the program. So there is, within Colorado, when it launches, there will be a clinical facilitator license that is specifically for people who have additional qualifications beyond the training for a psilocybin facilitation. And in Oregon, that was not baked into the original rules. And so we are leading a coalition of support behind a bill that will be introduced in the upcoming legislature to add that explicit dual licensure protection into the Oregon program so that we really can strengthen those ties between the psilocybin therapy work and broader mental health work that's going on in the state.
Taylor, really appreciate this. And for, I know a lot of us, the kind of leadership of Healing Advocacy Fund to assure safety and quality. And the kind of bridging you're describing with Mental Health Colorado is the same kind of bridging that's helpful in ballot initiatives moving forward in Massachusetts, where the Mental Health America partner in Massachusetts, Donna Mausch there, is helping advise from the beginning so that the mainstream and psychedelic fields are really coming together. And just fabulous work you've been doing to help bridge that. I think another key person that I'm looking forward to introducing now is a bridge person between philanthropy and mainstream mental health and in the psychedelic field, and that's Mike Cotton, who has extensive experience as an executive in a Medicaid health plan. But Mike, you've also become a founder in the Psychedelic Health Equity Initiative, so that we can talk a bit about For All and what equity means in this. And you've been working to bring the most advanced thinking on health equity into the foundations of psychedelic care as it moves forward, with the development of culturally attuned models and the evidence base to support eventual Medicaid reimbursement, so those who may be less affluent or have more struggle in the first place to get help to mental care are there. You're a funder. I know you make generous contributions into the field like so many of those on the call, and this is very personal for you. How did this become so important for you and your family as you describe kind of why you're in the middle of this field?
Yeah.
Mike?
Yeah, thanks, Tyler. Appreciate that. And I appreciate being here with all of you. Yeah, I mean, I'd start by just reiterating the fact that I spent 20 years owning and operating Medicaid managed care organizations. And so, you know, obviously Medicaid covering low-income, disabled people in this country. So I had a lot of experience on the front lines of trying to do population health improvement in these low-income, low-resource environments. And, you know, it's what became quite obvious is mental health and the delivery of mental health and having good mental health tools were just significant challenges. And you just, you know, you'd run up against a certain barrier of being able to help people get access to care and live healthier lives because you couldn't solve for those issues. And a lot of them have to do with the fact that they are poor and systemic issues, violence, you know, intergenerational traumas that just weren't equipped to really help people with. And so when I learned about psychedelics, it was one of those sort of aha moments for me, like this could be a really powerful tool for helping people reshape their narrative, you know, move through grief, shed their trauma, and be able to live healthier lives and get engaged in life again. And obviously the reason that I feel so, you know, I feel like it's such a powerful tool is, you know, in my own life, but it's been instrumental in saving my marriage and, you know, reconnecting me to my child. My second child was born premature at 27 weeks. And after an 18-month battle with severe epilepsy and all kinds of complications from that, she ended up passing. And was a really challenging experience, obviously for many reasons, but she spent half of her life, 9 months in and out of ICUs, severe epilepsy, uncontrolled epilepsy. You're living in a state of hypervigilance, wondering when the next seizure might send you to the hospital or might be the last seizure. And that was obviously very challenging time. And once she was gone, that sort of clarity of mission of, protect your child, save your child's life, get to the next thing to take care of your child is just sort of instantly gone. And while my wife and I were a really good team taking care of her and our other daughter at the time, once she passed, that's when things actually began to get quite a bit much more difficult. And we were both moving through grief, processing our grief in different ways. We were using alcohol to cope. We were addicted to Xanax. That took us 3 years to wean off of. It's a really challenging medicine. If once you become accustomed to it, to get off of it is really, really hard. And we, had the chance for about 3 years after she passed to do MDMA, and it was just a life-changing experience, right? I mean, we were able to, the defenses came down, we were able to say things to each other that we weren't saying. We were talking about things that we weren't talking about, and really, tapped into just a deep well of love that, we may have forgotten was there. And we both credit it with saving our marriage. Absolutely. And being able to process a lot of this grief and see each other for who we were. And really it helped us start to reshape the narrative of our marriage. And that was, really critical. Obviously still a lot of challenging work and work on it ourselves to move ahead, but it was just that catalyst that happened. And once I actually got into this work, we were able to get access to psilocybin treatment. And there's a woman who was running retreats for parents who had lost children. And so we were able to connect with other parents that had gone through this, and it had completely changed their lives, that had more gentler, beautiful relationship with their children. And, where I had no relationship with my child after she was gone, I, felt really nothing there. I was reconnected to her again. And then it was a really hard experience. I don't want to, say these are panaceas and they work, instantly. It was a really challenging experience for me. And it took me several months afterwards to really, with support, psychosocial support, family support, other people that had been here before, to really make sense of it and kind of, watch it change shape for me. And I mean, from where there was nothing, I realized, my daughter was a gift, and she's a mentor of mine and a wisdom keeper of mine. And I really started to see that the time that I spent with her in the ICU was spent with a lot of people that were on my health plan, that were covered by us, that were going through all the things that I had seen on claims paper and medical management, utilization management. And I saw, real suffering from families that had a lot less than I did. And these, ICUs, especially in inner cities, they're mostly low-income, low-income populations and demographics. I mean, the sick babies, illnesses, I mean, they're so prevalent in these, in the poor communities. And I saw a lot of death. I saw a lot of families struggle. I saw a lot of children die alone. And it just really shaped for me. Like, she showed me unimaginable grief and the resilience on the other side of that. And just realized for me, a mission is, what can I do? What can I continue to do to help people that are in need, and certainly that have less than me? And there's lots of challenges we can go into in a little bit about the Medicaid community and these communities and how we can help them. But it was really what gave me the charge and the fuel to say, we got to figure this out. These are not people being treated now. These aren't the people that get to participate in clinical trials. There's not a lot that we know about how to support this work for people that are living in these kinds of conditions. Be it, how do I get off of my job? How do I have childcare? Where am I going to go? Who's going to actually provide the care? Because it is really important to have people that understand what you're going through. And then also, do I have safe spaces? Am I in a community that's dangerous? How can I enter these vulnerable states? and continue to be cared for? And what does community engagement look like, which is really critical. It can't be overstated how important community support systems will be for people that are from low-income neighborhoods, because they're not going to have integration specialists and a 5-day retreat and all these other psychologists and psychiatrists and lots of support systems that will be paid for. So it's really important that we learn what kind of community support systems can play a role here. And, I think Tyler will have some follow-up, in a little bit, but I think I can stop there. But, I just really, these are the communities that are suffering the most trauma. And they also have the biggest barriers to access. And if there's not a real intentionality around how to solve these barriers to access, they're going to continue to be left behind, just like you see really in all other aspects of life.
Mike, thank you again for telling a vulnerable story of you and your family and how much these medicines have meant to you, and it's kind of helped you be here today in many ways from our personal conversations. And not only have you been so generous in your own philanthropy, but to pair up with some other funders to launch the Psychedelic Health Equity Initiative to ensure that there are pathways, not only just access to treatment, but in the chat and chatting with someone, but also to the recovery supports and the community supports on the other side, so that people of all walks of life have access to the best, if you will, and the kind of potentials here. So thank you so much for that leadership, and we will return in a bit. Our third panelist is Miriam Volat, who is also a member of the Mindful Philanthropy Network over the last couple of years. Miriam is a leader at the River Styx Foundation, and therefore also a funder, but also helping lead the Indigenous Medicine Conservation Fund, working to uplift, protect, and bring learning from indigenous practices where nothing's new about this at all. These are medicine practices that are hundreds, if not thousands of years old, and wisdom traditions, and how we can bring that learning into practices in psychedelic medicine. So maybe, Miriam, you could share just a little bit about why River Styx is investing, why the Indigenous Medicine Conservation Fund, and what can we learn from indigenous communities that would help us with mental health in the US? So Miriam, please.
Thank you, Tyler. And thank you, Mike and Taylor. I was so into Mike's story that I almost forgot what my bullet points were going to be. And Mike is actually also a seed funder, he and his wife, of the Indigenous Medicine Conservation Fund. And as Tyler mentioned, I'm the co-director for a small family foundation called River Styx Foundation. And we've long been committed to supporting and increasing mental health. We also work a lot on criminal justice issues. And the first entry point we had to this kind of psychedelic movement that's growing, and the knowledge base of how to use these medicines in a really healthful and ethical way, was actually supporting a cancer anxiety study 14 years ago at Johns Hopkins, which was one of the studies that really kicked off this new round of research and exploration into how to use these medicines for just overall community health, mental, spiritual, physical health. And around 8 years ago, we were also doing some support in Native American communities, which many folks know and some folks don't, has under 4% of philanthropic dollars actually go into these communities. They're also the communities that have the highest rates of suicidality, the lowest life expectancy, the highest rates of alcohol and other substance use disorders. And so we were really looking for a way to deeply support mental health and recovery in those communities. And found that when we did some community-based assessment work, that actually the tradition around using peyote in a community setting, in a ceremonial setting, using traditional knowledge, was one of the best tools, and it was even being used in Indian Health Services and by some of the tribes to address addiction issues and depression issues in these communities. And there was something very special about it, because it was really supporting the direct addressing of generational trauma from kind of our post-colonial experience. And so that sense of identity and the community that was built around ceremonial processes was like nothing else, but there was really no philanthropic support going into ensuring that these traditional methods could be really integrated into health systems, but also that they were supported by having like the elders get, taken care of. And then also to confound this, we learned that peyote was actually a threatened species and plant, and that as the interest in psychedelic medicines was increasing, actually the pressures on the native population were increasing. And so it was really out of that work that we did some community assessments in other places and found that there was really a need to not only conserve these medicines as interest grew, but also conserve the knowledge, and the existing community pathways needed to be strengthened because most of these communities are very poor. And so even just gasoline to bring an elder out to a community is an issue. And so for us, it seemed very, very clear that in our commitment to ensuring that psychedelic medicines were healthfully and ethically integrated into mainstream society, that we really protect the medicine, the knowledge, the communities, but also increase their ability to access culturally appropriate and systems of mental, spiritual, and physical care. And so that's kind of where that came from. And it grew into having partners actually in the communities ask us to form something called the Indigenous Medicine Conservation Fund, which has become an Indigenous-led, people from the communities actually do the decision-making around which projects and processes will really lead to the best health in the communities. And, one of the reasons why we got behind an Indigenous-led philanthropic model is that it's actually been shown to have much better results, both in conservation, community health, that when you have leadership from the communities engaged, then the outcomes are much better. And so that was a little bit of a mouthful, but we feel that it's unequivocally critical as expansion and access to these medicines grows, that we don't forget to attend to these communities that often do get forgotten by philanthropy, by policy, by legal processes. And we're hoping that we're really hoping that we do a good job as a community in this respect. So
Miriam, I love so much of what you just said, and not only communities that are often forgotten, but communities that have so much wisdom to offer about how to use these treatments. Some of my encounters in tribal communities in the US, their circles with these plant medicines are some of the most powerful way to bring people back into community after incarceration or struggling with substance use disorder in ways that are true recovery communities in the deepest way. So we have so much to learn, and it's beautiful to see you centering that. So I think those of you on the call, as we move to the next round of questions, you're seeing this sort of depth of thoughtfulness, not only about radical inclusion of the wisdom of communities, the consideration of equity for who may not have good access, but how do we do that in a professional way? How do we do it in a way that it gets paid for through Medicaid, and tailor the kind of thoughtfulness around safety and quality that you are bringing to this. And also, I just want to point out, for those of you when you look at who's on this call here, the thought leaders, the philanthropists and thought leaders of both of these funder collaboratives is really extraordinary. And I just want to also name my fellow board members of Mindful Philanthropy, Pam Herring, Paul Heller, Joe Pyle, and forgive me if I met others who are on here and who are helping really bridge this extended community. So we're mostly a call on philanthropy. And I'd like to come back to you, Taylor, and then Mike and Miriam. just to kind of briefly say, how us as philanthropists here, what is the role of an opportunity for philanthropy in advancing your work? And let's just kind of get specific about how can we as philanthropists make a real difference in the field?
Mhm.
Well, the first thing that I would say is that we really are trying to build a field here, not an industry.
Yes.
And because of that, there is not necessarily at this early stage this overwhelming capitalization of what's happening. In my view, psychedelic assisted therapy, when it's done well, really is about care and not about significant profit. It doesn't mean that these don't ultimately have to be viable business models. They do. We live in America. But in a world where investment is often looking for hockey stick growth, massive returns, quick turns, philanthropy is what ensures that good ideas have the time and the space to grow. And I think right now in the psychedelic field, particularly in the psychedelic therapy field, we are in that growth space where the people who care deeply about this and who are in the best position to build this in the right way need the support and, frankly, the soil to grow roots in, so that they can get established without having to immediately deliver the kinds of returns that a private investment or capitalist approach would require.
I really appreciate there's proof pointing, there's de-risking, and the kind of things that would help move a field forward more broadly. Again, not just to make companies some money. I so appreciate that ethos. Mike, you've been in the thick of this as well. What do you see as the opportunity philanthropy with Psychedelic Health Equity Initiative, but also more broadly?
Yeah, I mean, certainly, within equity, we're basically completely supported by philanthropy at this point, and there is a desire. I mean, the way we're designing our programs is absolutely with a forward thought of how do we unlock government funding and state funding, federal funding, PCORI grants, HHS and CMS. These are all going to be ultimate stakeholders, but we're in a real proof of concept phase. So we need to start treating people from these communities and really learning what models can work and how can we do it in a safe way. And so that's that really is led with philanthropy. And and I guess in one specific case, we've got this phenomenal program in New Mexico that's working with the University of New Mexico. The state legislature actually is interested and is providing a little bit of the funding. So there's already some state funding that we get to partner with, and we're coming in and funding some of the community engagement aspect. But it's going to be working with Native American population, Latino population. There's a lot of opioid abuse going on in these communities. And we get to come in, and we're also developing a data model. We really want to take a data-driven approach. I love philanthropy for access. I mean, it's really great that many people are getting access to these because they're still expensive and hard to do without philanthropy. But what I really want my philanthropy anyway to do, if I'm helping fund access for people, is how can that then help everyone, right? And so if you have a really strong data model and you're taking a data-driven approach, you get to actually see what's the intervention, what's the outcome, what were all the support systems that are necessary, so that then we can go, specifically to health equity, we can go to state Medicaid agencies, HHS, CMS. These are all the support services that you should pay for on top of just this medicine, because that's what's going to really make the safe container and make these outcomes last over time. And that really is partnering with, we don't think psychedelics are going to solve the world. It's partnering with the groups that exist now that have community organizations, community agencies. They know the people that need housing assistance and food assistance and clothing assistance and actually work within the communities and support the communities in many ways. And then how can we layer in psychedelic care into that ecosystem so that we're helping treat the trauma and help people live fuller lives?
Mike, really appreciate that. And as well as the kind of thinking of the wraparound care that we know is needed besides these molecules to support that people really are doing better. And also the work you're doing with mainstream mental health organizations. And we're partnering with that, as well as a few other funders, Jeff Walker and others that are on this call, to work with both APAs and the social workers and others to make sure that those therapists have access in the way Taylor described earlier. Miriam, what would you add to the role of philanthropy and how those members on this call could be thinking about their philanthropic dollars moving this direction? She may have just frozen there. Is that possible?
It seems like it, yeah.
Yeah, she did. So while we're waiting for Miriam to come back, Mike and Taylor, if you might just ever so briefly, oh gosh, I think we may have lost her, but let's go to you two for a minute. If you could just ever so briefly say, what's sort of the big challenge, the big obstacle that, gosh, if we could break through that, it could really open all kinds of possibility. What would you lift up to the top of the list?
You know, really a lot of it comes down to the idea that this is just not something that has been done before. And there are certainly analogous approaches to look at, but there's a lot of uniqueness here too. And that means that it requires, frankly, resources. It requires convening expertise from a lot of different places because there aren't sort of set clear best practices and clear experts to say exactly how this should be done. And it requires organizations like Healing Advocacy Fund, like the Psychedelic Health Equity Initiative, to really try to understand and problem solve around those challenges so that 20 years down the road, we've worked out a lot of the things that were challenging and unique about this. But we are in a novel stage right now, and that has brings with it all the challenges of not having a clear precedent to follow.
Thank you, Mike, and then we'll come back to you, Miriam. We're just focused very briefly on obstacles and challenges. Mike, and then back to Miriam.
Yeah, I mean, look, I think when it specifically to my work, the challenges are numerous. I mean, you've got stigmas within communities. There's a whole that whole piece of overcoming, like, what is this? How does it work? This seems kind of kooky and crazy. Like, just being able to kind of enmesh yourself into these communities to actually do that. And by the way, many of these communities have been devastated by the war on drugs. So there's a lot of hesitancy around, taking drugs and how that can solve the problem. And then, you've just got the delivery system challenges and the people to actually deliver it. Where can I go? What are the spaces to actually go get this care? And who's going to provide it? I mean, these are already in the mental health system now, community mental health agencies where people in these communities typically access mental health. They're underfunded, the people are overworked. And so, being able to kind of help, insert yourself into these tired systems and try and, inject this kind of work, it's going to take money, it's going to take effort. And I think that's why we need the data that we're trying to collect to prove it out so that we can really get feds and states to say this is worth investing in.
Thank you. Miriam, just a 30-second response there as we start to wrap up. Please, what barriers and obstacles you would focus on, please.
Yeah, I mean, I think one thing, and there's a big tree fell outside of my house, and that was why I disappeared for a second. It did something to the Wi-Fi, so my apologies. But what I really did want to share, I think, from a philanthropic perspective, really ensuring that as we open up access to these medicines, we do it in a way where we don't harm the populations and we actually really support the traditional knowledge holders is really exciting, because you can actually get a lot done with less money than in some of the other spaces, because there already are existing delivery of care models. It's already legal for traditional folks. And kind of like you mentioned before, Tyler, as I think if we really support these communities, we'll actually learn, and there'll be a knowledge exchange that will benefit all different sectors of society. And I think some of the challenges with that also are that a lot of Indigenous communities don't have some of the structures in place to be able to accept funding and support unless it's through like a tribal government or something like that. And so that's a lot of what we've been working on, is helping people create actually organizational structures and interface with philanthropy so that they can do this work, the women's programs, the kids programs, all of those things. And then I think just it's hard to talk about issues around like how this new exciting effort might actually re-traumatize some of these communities that are already dealing with a lot of trauma. People feel shame when you talk about it. So I'll just share bluntly, like one of my biggest challenges is that, you know, how do we talk about the risk of re-traumatizing folks in a constructive way that shows people like good entry points and what could be beneficial. So that's one of our biggest challenges right now.
It's beautiful. I know this time is so short, and so I'm going to ask each of our panelists, and also you, Dan Grossman, please, for your beautiful opening, if you wouldn't mind just dropping into the chat just a one-liner on what's your vision of where this field could be 10 years from now. And Miriam and Taylor and Mike, if you could do that, and Dan, I'm just gonna, if I could give you 20 seconds here. Obviously, the Psychedelic Science Funders Collaborative, since many of us are here with Mindful Philanthropy, is the go-to place for funders. Can you just give us 30 seconds on how should we find you? How should we work with you? And then I'll turn it back to Allison to close us out.
Well, there are so many ways. PSFC does a variety of things for its members. We host webinars on various specific topics. You know, we have psychedelics and religion, and we have the health equity activity and other things that you've heard about today. We do have in-person convenings from time to time where funders either active in the space or just interested in the space can come and interact with the leaders of some of the nonprofits or interact with other funders and try to have some mutual learning. And there's also just pretty extensive dialogue out in the network between funders trying to help each other find opportunities to do the most good. If you do wish to learn more, it's not that we're overly formal about membership, or we have some guidelines, we do have some guidelines about that. But if you just wish to learn more about it, please reach out to me. Tell me a little bit about what you might be interested in finding out more about. And I'd be happy to speak with you or to put you in touch with a colleague who can educate you more. There's a wonderful woman who's a counterpart of mine in our organization, Rose Iznova, who is our Chief Community Officer, who can also be quite helpful in that regard. Thank you.
Daniel, thank you. I really appreciate this fabulous presentation. To all our panelists, 2 quick responses to question. Yes, Kaiser Permanente, they did early work around psychedelics, is very interested, because if you could not only work with the behavioral health issues, you could unlock the behavior change around other chronic conditions, hypertension, diabetes, et cetera. So strong interest there. And yes, take a look, another question around the Dutch Ministry of Health has done deep work on MDMA, and there's a lot of work across Europe and Israel, as well as in the United States. Allison, thank you for hosting us. Let's give you the final word, and such a beautiful afternoon together.
Well, thank you, Tyler, and thank you to Graham and Dan and all of our panelists. We really are grateful for your time and your expertise. It really is evident that not only is there a lot of personal story behind psychedelics and historical use and record of psychedelics, that there's a lot of momentum and a lot of efforts happening around this right now. And we're excited to see where this really goes and how we integrate this into the mental health ecosystem. So I want to just encourage you right now, there's a QR code that's on the screen to explore our public guidance from Mindful Philanthropy. And I want to highlight that we actually have a new piece of guidance that's coming out in 2 weeks, which is the US funding landscape, which is much anticipated in terms of how much philanthropy and the dollars are going into mental health addiction and well-being, and where is it going and where is it coming from. So I encourage you to scan, also to make sure you read that report when it comes out in a few weeks. And then I just want to note that we will be having a survey that will go out and I think it's going to be dropped right now in the chat by our team. And so please do fill that out and give us some feedback, give PSFC some feedback today on our webinar, so that we can continue to get better. We're always looking for ways that we can grow and improve and get better as we go about doing the work of catalyzing impactful funding to mental health addiction and well-being. So thank you all so much. We're really grateful for your time and hope this has been an informative session. And thank you again to PSFC on their partnership in this incredible topic. Thank you so much. Have a great day, everyone.